So I've been asked to show you how to utilize the nebulizer machine that you probably just picked up or purchased. And today we're going to take you through a walkthrough of how this all comes together. Now, what you've received is the machine itself, and my machine might actually be a different model or a different make, but they all run pretty much the same. You see, it's really just a compressor with air that forces air through. The actual compressor motor is back here, and it's going to force air through the tube and actually up through this plastic chamber, and yours is going to look very similar, with the attachment to a mask. And the mask actually does disconnect and can go directly on the chamber like this. These masks are adjustable, and I will show you at the end how to make that adjustment. But these are the types or the parts that I want you to get customized to. This is the tube, easily enough. This is the chamber. We unscrew the chamber here, and it's not really a screwing motion, it's almost a sort of screw and tip. And so the medication, in fact, would go directly into this area here. There is actually a little plastic compartment or a plastic container that goes in here, and the medication would just go on the top of that. It's actually graduated to tell us exactly how much is in there. So again, we would put medication in here, and I'm going to take you through that. And we would close it tightly as such. We would attach the tubing to the machine here, and we would turn it on like that. So that's just a dry run through. About the machine itself, it is fairly straightforward. There's actually an area where the only consumable and the only thing that has to be changed is occasionally we have to change a filter in the machine, okay? And that should actually have come with the machine that you've received. So let's start over here. We'll put that aside for a moment. We've set it up as such. So you've also been supplied a syringe. This is the syringe, and this is the needle. This is what's known as a drawing up needle. It's called that because it's a really thick needle. It's 18 gauge. See how thick that needle is? Okay, so when you're doing this at home, you really don't have to use gloves. I'm using gloves for the purposes of our demonstration today, but this is how the syringe and the needle connect. So the syringe, actually, it's called a Luer lock, which means you have to twist it to turn it, to put it all together, and then twist it like so to take it apart. So again, let's do this now and fill it. Now, I've probably instructed you how often I'd like you to do this, but the general fill for what goes in the chamber here is going to be 4 cc. Now a cc is the same as an ml, a milliliter, okay? So we will start, first of all, by drawing up 2 cc's of our glutathione, which has been compounded by one of the pharmacies to already have a little bit of saline in it. Then we're going to dilute that a little further by using our saline that has been provided in one of these little saline bags. Here we've got what's known as a 50 ml container of saline solution, or normal saline. So why don't we start? So I'm gonna prepare now. I've taken these both out of the fridge. That's where I'd like you to store them, is in the fridge. We will start here, and you probably have at home an alcohol prep pad, or it's been provided for you. We do one little swipe here of the top of this container, and one swipe, or actually I will be opening this up now, and you'll see that this little plastic or rubber top looks the same. It's just a little smaller. Okay, so that's where you know where you're gonna go and actually draw out the solution, because they look the same, don't they? So here we are. We will start by drawing out, first of all, our solution, our medication, the glutathione. So you push the needle into the rubber top, and all you have to do now is, just like you see on TV, you pull back on this top part, which is called the plunger. So notice the fluid is in fact coming up and through the syringe as such, and I'm going to do my best to get 2 cc's. All right, I've got a little air in there, so I'm just going to push it back. It's not going into our bodies, so it's okay. We'll get some of the air out and push or pull back until we actually get 2 cc. And there I am. The mark is actually red essentially at the very top of the plunger top. Okay, so that's 2 cc's. thereabouts. And, it's not an exact science, so it's all right. Now, what I'd like you to do is, because it's not so easy to mix these things, like if you're really skilled with doing injections, you could then go directly into this chamber and pull out 2 cc's or 2 mLs of saline. And that might be useful for someone who's done this a number of times, but here's what I'm going to do. I'm just going to put the solution in here, just like this. That is my 2 cc's of glutathione. And notice I'm not even having to move that secondary piece, that blue piece in the middle. I am just going to put that in there, and we're going to hold it steady like this. Again, it might just be that you have to sort of gently put it aside. Notice that. And again, I know that I've already wiped that off. So here we are. I'm going to go in that stopper top. Remember, I'm just going to pull back again exactly the same way and get 2 cc's now of the sodium solution, or the normal saline solution. Again, unscrew here at this part, and notice I've tipped a little bit there, so I'll just put it down. And now again, I put 2 cc's of that saline solution in there. Okay? Cover the top. Now we're all set here. All right, now before I actually start my treatment, what I'm going to show you is what I do with everything afterwards. Now notice what I'm doing here. I have taped. There are some holes that sometimes are present in these masks, and I find it's just a little bit of a waste, right? So if you've got tape around, just tape the hole so that you don't waste the mist. That's what we're creating, is we're creating a mist for that fine particulate material to actually get down into the lung tissue where we need it, and the respiratory tissue. So this is where we've got this little plastic component, and it sits on the top of the mask. All right? And so what you may have to do is actually bend that so that it fits the face effectively. Before I actually start my treatment, and again, it's just a little, there we go. I'm going to put away my solutions. All right, so now we take this solution. We can actually store the needle and the syringe exactly as they are. Likewise, the glutathione. We could put this all together, and if you've got something like a Ziploc bag that you'd like to actually use to put the material in, we can. We can put it in the Ziploc bag, have it all nicely together, and then put it directly into the fridge. All right? And I've probably instructed you to use it at least 2 to 3 to 4 times per week. That I would have told you during our session. So consult your recommendation sheet for that amount of time that I'd like you to use it. So here we go. We're ready now to actually start our treatment. It shouldn't take too long. And it will take, for this amount of material, which is now 4 cc's of material, it will probably take, or solution, it will take probably about 10 minutes. So here we go. We've got our mask, and all we have to do now is put the mask on, as such, and adjust the metal portion here, like this, and we can then pull our the elastic pieces, the elastic parts that are right here. Okay, just like this. And now we're ready to turn it on, and that's what I'm gonna do. Okay, just turn it on and breathe. See, it starts to get misty. All I want you to do is to actually just sit back, relax, maybe watch your programs, read, meditate, spend some time with your thoughts. And what I'd like you to do is to just realize that there is a bit of an odor to this. It smells a bit like sulfur. We would have talked if you have a sulfur allergy. It's something that I'd want you to make sure you let me know. But that sulfur smell, you get used to it fairly quickly. And after the treatment, what you might notice is that there's a little bit of a runny nose, or a little bit of a moisture in the throat area, or even just a little irritation. These will pass, okay? And it will become something that you get quite used to. All right, well, let's take this off. And I hope that's been helpful for you. If you have any other questions, make sure you contact us at Pinewood Natural Health Center.